are here today with Tiffany Basamon, the Director of Nursing at Heritage Christian Services. Tiffany joined HCS in 2022, bringing with her a wealth of knowledge from the University of Rochester Medical Center. She holds degrees from SUNY Geneseo, University of Rochester, and Roberts Wesleyan, including a Doctor of Nursing. Tiffany, congratulations on being the first audio interview guest of our monthly Mission Spotlight. This month's Mission Spotlight is all about the nursing team, and we're so excited to learn more about your team and how you worked together to walk alongside the people who choose our services.
Good morning. Thank you for having me. This is a really specialized field of nursing in which we support those that choose our services really in achieving optimal health by endorsing the promotion of wellness as well as inclusivity and advocacy.
Let's dive right into some of our questions. So tell us all about your team. How many nurses do you oversee?
Sure. We have an ever-growing team of nurses. Right now, we have 32 RNs. 3 of those nurses that are RNs live in what we call a nursing support specialist role. And then we have an additional 4 LPNs on the team right now.
And how would you describe the nursing team in 3 words?
3 words is very limited to describe our unique team, but I would say they are very compassionate, dedicated to the mission, and a resilient group of nurses.
Can you provide an example of when the nursing team demonstrated each of those qualities?
A lot of our nurses, our core group of nurses, have been with the agency with some longevity. They've worked through the agency with COVID in mind as we've changed priorities. As far as resiliency as well, these nurses really support individuals across the lifespan. And unfortunately, sometimes that comes with hospice care and supporting end-of-life needs. And these nurses do it all at the bed, at the house, and allow people really to have a unique end-of-life experience as well. They're very dedicated. As individuals go in and out of the hospital, for example, these nurses will take call 24/7 to help coordinate and provide that continuity and care when somebody's hospitalized. And as far as compassionate, I think the relationships they build with people, it's evident in that.
Great, thank you. So you talked about it a little bit, but here at Heritage Christian, we have people with all different kinds of medical needs. How does your team communicate with one another to stay on the same page?
Yeah, I think communication is ever evolving. Sometimes it can be a challenge. We use a lot of the standard means of communication. So, email, Teams, our cell phones typically ring nonstop. However, I think something that is really effective for us is small team meetings that we have. They're typically led by the team NSS, and this is an opportunity for the team to do medical rounds, be able to talk to colleagues, get input from other nurses, bounce ideas off of each other, and get some feedback. I think that's really helpful sometimes if a nurse is stuck, being able to have those conversations in those small group meetings. And then as a nursing team, we have monthly meetings, which are really agenda driven and not so much of this small team communication.
What's different about being a nurse at HCS compared to other organizations?
Well, I think being a nurse at HCS is extremely different than many other settings, so it's very different than a hospital-based setting. But in that arena, it's different because we're very autonomous. We're working out in the field. It's I try to describe it sometimes as a cross between home care and long-term care, but that doesn't really seem to hit the nail on the head either. And so I think what it really sets us apart, though, when you compare us to other community organizations, is our drive for excellence and the quality. I have a team that I feel is very engaged in change management, and they're not necessarily satisfied with being complacent. And so sometimes I have to drag them along kicking and screaming, but they are really receptive to new ways of thinking, trying new things, and part of that is bringing a new level of quality.
Fantastic. And can you talk a little bit more about how the nursing team lives out the mission of Heritage Christian Services?
I think as the director of nursing, I'm a bit biased, but nurses play a crucial role in supporting our mission. The nurses at HCS really value compassion, dignity, and I guess I said before, inclusivity. They are really central to our mission. The nurses here are committed to compassionate care, as I said before. I think they really try to work an understanding and kindness through their trade, and they create a safe and nurturing environment where people really feel they're approachable, supported, and valued. And then I think nurses are also part of a team that uses a holistic approach here. It's not only about the physical interventions, but also emotional and social aspects of wellness. They collaborate with an interdisciplinary team that includes a number of other clinicians, our direct support professionals, as well as those we support in families to develop personalized care plans. And nurses really play a vital role because health and wellness is a key component in living lives of endless possibility.
There's clearly some great work being done by the nursing team here at Heritage Christian. Tiffany, thank you so much for joining us today for our Mission Spotlight. Would you like to share a high five to your team?
A high five for my team would be that I am filled with gratitude and admiration for each and every one of you when I look at the positive impact that you have on the lives of those we serve. You strive for the highest standards of care. Your efforts, compassion, and unwavering commitment make this community a better place. So thank you for all you do.